Hi, everyone. My name is Kate. I am a nurse educator here at Women's Health Network. We are going to talk a little bit today about hidden food allergies, a topic that has been coming up quite a bit. So wanted to bring you a little more information on that. Joining me in the conversation today, we have Dr. Sharon Stills. She's a naturopathic MD joining us from Arizona. Hi, Sharon.
Hi, everyone. Nice to be here.
Yeah, thank you for joining us. And we also have our clinical nutritionist and medical anthropologist specializing in bone health, Dr. Susan Brown, and she's joining us from upstate New York today. Hi, Susan.
Hello. Nice to see everyone.
Yep, thank you for being here. So, in the area of food allergies, we hear a lot. I guess I want to start by making the distinction between a food allergy and a food sensitivity. I think those terms are kind of used interchangeably by a lot of people. Is there a difference? Is there an important distinction? Sharon, what do you think?
Definitely. So a true food allergy is mediated by the IgE section of the immune system. And so that is the kind of thing where you eat a strawberry and you have an anaphylactic attack and you can't breathe and your eyes are swelling and your lips are swelling, and that is a true medical emergency. And a food sensitivity is more a delayed reaction, so it's moderated more by the IgG portion of the immune system. And this is going to be something that is not going to be so acute, but is going to cause a lot of havoc, as we'll discuss during this conversation, on your body and create certain health conditions that you might not even think about are related to foods that you ate.
Okay. So, Susan, did you have anything to add on to that?
Yeah, I would just add on that you can have food sensitivities that are not mediated by the immune system, that wouldn't fall into that category of the white blood cell attacking something like with the IgE or the delayed responses. You can have food sensitivities that are digestive, for example, that I don't have the enzymes that I need or to digest a particular food, like people that are milk intolerant, for example, may lack a certain enzyme. Or that digestively a food agrees with you, but it's not mediated by the immune system, and yet you're still sensitive to it.
Okay, so for the purposes of our conversation today, I think we're really referring more to food sensitivities. If you have a food allergy, chances are you're well aware of that.
There's a problem that 80% of all food allergies are delayed. In other words, we think of allergy, like Sharon expressed, as the immediate response, which is an antibody, IgE, that acts very immediately. You go into a room, you smell a cat, you get a headache, you get hives, whatever. But 80% of all reactions, white blood cell, what I would call allergic reactions, some people call them hypersensitivity reactions, are delayed, and they take up to 4 days. So it's a little confusing. You might say, gee, I ate corn today, I'm fine, but a couple of days I got this wicked headache back again. I happen to have worked many years with tests that can uncover these delayed sensitivities, and they really seem to be at the basis of many autoimmune and serious diseases. So yeah, it's you only know the tip of the iceberg when it comes to your food sensitivities or your food allergies. You can only identify those, the immediate ones, really, because if they're delayed, you don't, this kind of person says, geez, I woke up in the morning with a headache. Well, I didn't eat anything overnight, yet it was probably something they ate earlier or were exposed to in the evening.
Which is important for people to know, that there can be a difference, even with all the best food journaling in the world. It's hard when there's a period of days sometimes in between to identify what your triggers are.
And that's why you get into these elimination diets where you take 4 days and you eliminate totally the substance, and then you say, okay, let me see, I've cleared it from the system. Then you only introduce that substance for 4 days. So you introduce dairy, maybe just you're off it for 4 days, and then you just make, only change you make is to add that for 4 days. So it's a little tedious process to detect the delayed hypersensitivities.
So there's kind of a commitment involved to figuring out where your sensitivities lie.
Right.
So what are some of the more common trigger foods or more common challenging foods for people who maybe they know something's wrong, but they don't really know where to start or what it is that they're eating? I know an elimination diet can be helpful, but what would be some of the more obvious foods that they should look into?
Well, that's an easy one. So I would say gluten and dairy are the biggies that I see in my practice and with patients. And so I do a lot of blood testing. There are certain alternative labs where we can test, like Susan was saying, the white blood cell reaction, so we can see by testing the antigens of the food if there's an agglutination, which means is it getting sticky, are the white blood cells sticking to it and clotting. And so we can do testing and see what people are more specifically allergic to. But if you don't want to spend the money and you don't like having your blood drawn, very often I will just have patients, and a lot of it comes from taking someone's intake and looking at a food diary, and so you can see if they're always eating dairy, or, you know, one of the things is when you tell someone you have to give up dairy, if you notice in yourself that you go into shock and panic and anxiety, chances are you're probably addicted to it, and we're often addicted to the foods that we're allergic to or sensitive to. And so I have found just by taking dairy and gluten, soy is a big one, eggs can be a big one, often I see shellfish is a big one, nuts can sometimes be, eggs can sometimes be, and those are foods like nuts and eggs I really love, and I think there's a lot of benefit nutritionally, so we want to make sure there's really a sensitivity before we take them out of the diet, or at least, like Susan is saying, to check whether it's via blood testing or doing an elimination diet. But I have seen take gluten, take dairy out, and probably 80% of your problems are going to go away likely.
Yeah, and I find corn, I exactly found the same things, but corn is one of those foods that are hard to digest, like the grains that are very hard to digest. It's because an allergy always involves a digestive problem, that poorly digested proteins are leaking through the gut and getting into the bloodstream. And the white blood cells attack that particle, and that's what causes the inflammation, the runny nose, the headache, the gut pain, whatever. So you always have a digestive problem, so you look at the foods that are hard to digest. And as it turns out, some of these, like the corn, wheat, dairy, soy, sometimes eggs. But Sharon had a really interesting point you see over and over again in practice, that what you really crave the most is often what you're allergic to. So you just ask a person, what do you not want to give up? You know, can you give up your? I can't give up my spaghetti. Then you know it's probably worth a try giving up that spaghetti.
And I think what Susan is saying, I think it's important for those of you listening to understand that the digestive process, and so the gut being leaky, and so what I've seen in my experience is that when I do a lot of the food sensitivity testing, often patients will come back with, you know, I test for like 200 foods, and they can come back with sensitivities to like 70 foods, and these can even be foods that are like superfoods, like apples and blueberries and broccoli. And so when I see that, it doesn't necessarily mean, oh my goodness, you have sensitivities to everything. It means that the gut is leaky. And so when your gut is, when the junctions are not tight and foods are passing through that shouldn't, and the white blood cells are attacking and you're having that immune reaction, that you're going to be sensitive to a lot of things. And so we have to remember when we're dealing with food sensitivities that we also have to go back and heal the gut, seal up the gut that's leaking, and then the sensitivities will diminish as well.
Right.
Okay. So as far as healing that gut is concerned, and we've already touched on this several times now, but you know, we often will say that an elimination diet is going to be the first step in that. We've talked in other Hangouts about elimination diet and what that is and what that means, but it's something that's really worth doing a little research on. If you're having any kind of symptoms that, again, where we're not dealing with an anaphylactic reaction per se, anybody who's having symptoms like the headaches or joint ache or digestive challenges, there's really a whole wide range of symptoms that these food sensitivities can manifest as. So that would be a great place to start and a great thing to do. But Sharon, you mentioned with the allergy testing, that was going to be one of my questions a little further down, but we'll just jump right to it, which is great. how important is allergy testing? Is that something that we really should be recommending, or is it okay really to start with the foods?
Well, I usually put that back to the person who's suffering, and so it really depends upon what kind of person you are and how you want to go about doing things. So some of us like to do a test, we like to get the written word, we like to see a printout, and it inspires us and it motivates us. And if that's what you need, then I recommend doing some sensitivity testing. Others of us would rather just make our bodies a laboratory, and whether it's take out the top 8 offending typical things such as soy and dairy and gluten and eggs and corn and so forth, and just do the experiment for a month. It's free, there's no cost, so you're saving money. And then at the end of the experiment, you can add the foods back in one at a time, but my experience with thousands of patients has just been they typically end up feeling so good that the majority of them now I found substitutes, I don't even want to add anything back in. And if there's something they really want to add back in, you can try it and see how you do. And then at the end of the day, we're all big girls, and so you get to make the choice. When you add it back in, if you get a runny nose or your skin flares or your joint aches or your migraine shows up, you can kind of correlate and say, okay, dairy is going to do this to me. And maybe at some point you're going to be staring at creme brulee on the table and you're going to go, you know what? I'm willing to take one for the team. I'm going to have the creme brulee and I know I'm going to suffer. And that's your choice. But at least you have the knowledge and you can start making good decisions about what you do or don't want to put in your body and whether the creme brulee is more important at that moment than having a headache the next day. And if you are going to choose the creme brulee, then I say choose it with all your heart, all your body, all your cells, and really enjoy it, because there is something to the mind-body connection. And often if you're eating something and just really having pleasure and really enjoying it, the immune system won't go so crazy and you might not be so symptomatic. And then you just have to remember not to go overboard. So if you get away with something once, doesn't mean you can start having it every day, because you're going to end up in trouble again. The immune system is not going to put up with that.
Yeah, there's no tricking the immune system into tolerating that. So what's interesting to me is that food sensitivities, there's so much talk about food sensitivities now, where it seems like when I was a kid in school, there was one kid in the school who was allergic to peanuts. Nobody had any issues with gluten or with dairy or with anything, that we were aware of. And I'm sure you probably had similar experiences. Now it seems like everybody is sensitive to something. Is there something changing? Like, what are the factors contributing to that? Is it just increased awareness? Susan, what do you think?
Well, like Sharon pointed out, it has to do with gut permeability. You cannot have a hypersensitivity unless something's getting in the blood that shouldn't be there. And 90% of that something comes from the digestive tract. And just imagine all these antibiotics we take, for example, just one drug disrupts the intestinal flora, destroys the good flora. All this overgrowth of candida causes leaky guts. There's so many, just the lack of nutrients to create new gut tissue. The repair nutrients are lacking, so we developed a leaky gut for many reasons. So that's one thing I would say is the digestive strength has weakened. We as a culture don't pay any attention to digestion. If you look at ancient cultures like China, India, cultures that have been around for thousands of years, they're very careful about how they eat, what they're paying attention to when they eat. So that's the whole issue of digestion. The other thing that Sharon reminded me of is the white blood cells white blood cells are like your circulating mind. And every white blood cell decides, am I going to attack this particle or not? And it's only when the white blood cells are nervous and jittery that they attack that particle. Otherwise, they just soak it up gently like a sponge. You never know you have the allergy. So as our whole society becomes, in a sense, even more fearful, we've got more leaky gut, more proteins leaking through, and those white blood cells are a little bit nervous. So the happiness effect, the effect that if you're calm and relaxed, I've seen people that were very allergic to certain foods when their kids came home and they were happy they could eat anything, and I'm sure Sharon has seen a lot of those cases. So we'd say nurture that white blood cell, try to deal with something that's as profound as our tendency to worry and fear, and build digestive strength with the gut situation, which is as simple as eating the food in a peaceful place. We actually, on betterbones.com, have 10 steps to stronger digestion. It's a document I wrote that's a great place to start, because improving digestion, taking your probiotics, watch how you eat, will help a lot. Karen, what do you have to say about that?
Well, I agree with everything Susan says, and I'd add also to it just the quality of the food. And so the food that we're eating is very refined nowadays, and the overabundance of it, the GMOs. And so it's interesting. I notice a lot of patients will report to me, and I notice myself, like when you go over to Europe where the food is fresh and it's made with love and it's not so processed and it's not sitting on a shelf, that you can tolerate maybe gluten or maybe dairy that you can't tolerate here. You know, me personally, I don't eat dairy, but when I'm in Italy, I exist on gelato. It's kind of like breakfast, lunch, and dinner, and I do fine. And so there's something to be said to how we're refining our food and the quality of it. And I think that has a big part to do with why we're seeing so many more sensitivities these days. And I agree 100% with Susan. The permeability of the gut and the use of antibiotics, the overuse of antibiotics, is just creating a space where we're just becoming hyperreactive as a society.
Mm-hmm. Right. Mm-hmm.
Right. So increasing the quality of the food, maybe this time of year shopping at your farmer's market instead of getting your peppers from Argentina or wherever, being mindful of how and when and where you're eating. I know for me, it's made a big difference just taking the time to chew my food more thoroughly, you know, little steps that people don't even realize they're kind of creating, you know, for themselves that are very easy to correct. So there's a lot that we can do if people are feeling like they have sensitivities and want to get started. It doesn't have to be a big regimen of medical tests and things like that.
One thing I would say is that it's a new age in medicine, and like on betterbones.com now, we actually have an allergy test kit for 99 foods. You can just send in a little blood sample, and they'll tell you if you have these type of delayed reaction called IgG that Sharon spoke of. It's not all the delayed reactions, but it's pretty nice. So if you fancy test, you can go check betterbones.com in the shop. We have that. It's pretty amazing that people can sort of take more charge of their health these days. A good place to take charge of is your digestion, because that's the hub of life.
Mm.
Exactly. What do we have without our digestion? You know,
illness, disease.
So, okay, ladies, that's all the questions that I had today about these hidden food sensitivities, and I do appreciate your time and putting up with the few technical difficulties we had getting started. So, thank you so much, and I look forward to speaking with you both again soon.
Thank you very much. Be well.
Have a great day.
Thanks.